So we now have got to the situation with experience with CT angiography that NICE, which stands for the National Institute of Clinical Excellence, which as you know is the government regulator that decides on new treatments and investigations, has actually now formally issued guidelines that CT angiography can be one of the investigations of choice, if not the investigation of choice, for patients who have a low or intermediate risk of having heart disease. Now, what sort of patients are they? People who come along with no symptoms but multiple risk factors or a bad family history, people with odd sorts of chest pain that you're not sure if it's cardiac or not. And let's make it quite clear, we're not recommending this test for someone who comes along with classical symptoms of angina or a heart attack where you may have to do an intervention. Then they would be much more likely to go for a conventional angiogram. But there is a whole vast number of patients who fall into the other categories I mentioned where CT angiography will be the right test. Let me just say one more thing, that the exercise test, the good old treadmill test, has been the sort of stalwart of testing. Oh, you've got a bad family history, have a stress test. There is absolutely no logic, and in fact there is no evidence that doing a stress test in people with no symptoms or with multiple risk factors has any benefit at all. The American Heart Association and the American College of Cardiology, they issue guidelines and levels of evidence for the use of a test or a treatment. So level 1 is you should do it, it's been proven. Level 3, which is where we are with exercise testing in people with no symptoms, level 3 means don't do it, it's not appropriate. But we still do it in this country because people haven't yet, I think, grasped how a stress test in a well person, if it's abnormal, is very likely to be misleading and produce something which is a, quote, false positive, unquote, test, which means it tells you there's something wrong when in fact there isn't. And that leads the patient on to further tests at more worry and more expense. So we need to move away from doing the wrong test to doing the right test, which is the CT, the coronary calcium score, and where appropriate, the CT angiogram.